Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics in the Gynecology Faculty of Medicine, Mansoura University. Let us try to answer some multiple choice questions in obstetrics today. Okay, choose the one best response. Let us start with the first one. Characteristic appearance of complete mole by ultrasound. A. Fetal hydrops. B. Honeycomb appearance. C. Irregular sac. D. Blighted ovum. E. Non-pulsating fetal pool. Please try to answer before me. Okay? So, the one best response here is B. Honeycomb appearance. This characteristic for molar pregnancy by ultrasound. Okay, let us go to another one. A contraindication in management of molar pregnancy includes A contraindication in management of molar pregnancy includes A. Use of ultrasound during evacuation. B. Suction evacuation of product of conception. C. Use oxytocin before uterine evacuation. D. Pre-evacuation evaluation of beta-HCG. E. Post-evacuation evaluation of beta-HCG. Please choose the one best response. Okay, the one best response here is C. Use oxytocin before uterine evacuation. Why? Because there is risk of amniotic fluid embolism because the cervix is closed when you give oxytocin infusions, so this is dangerous. So we are not going to give oxytocin before dilatation of the cervix. Okay, so this is contraindicated during management to use oxytocin before uterine evacuation. Let us go to the next. What is the most likely cause of miscarriage in a 23-year-old woman with past history of 2 mid-trimester spontaneous painless miscarriage of living fetus with normal karyotype conceptus? Again, what is the most likely cause of miscarriage in a 23-year-old woman with past history of 2 mid-trimester spontaneous painless miscarriage of living fetus with normal karyotype conceptus? A. Endocrine cause. B. Immunological cause. C. Anatomic cause. D. Infectious cause. E. Chromosomal cause. Please choose the one best response. And of course, try to answer before me. And at the end of this quiz, please write your score and comment out of 10. Okay? Okay, the one best response here is anatomic cause. Okay, anatomic cause. Next, uterine rupture in a case attempting vaginal birth after cesarean section can be predicted by, again, uterine rupture in a case attempting vaginal birth after cesarean section can be predicted by A. Gush of water per vagina. B. Passage of vaginal bleeding. C. Increased fetal movement. D. Prolonged labor. E. Non-engaged head. Please choose the one best response. Okay, the one best response here is B. Passage of vaginal bleeding. Okay, let us go to the next question. Which of the following is the commonest risk factor for placental abruption? Again, which of the following is the commonest risk factor for placental abruption? A. Hypertension. B. Leiomyomata. C. Thrombophilia. D. Cigarette smoking. E. Short umbilical cord. Choose the one best response. The one best response here is A. Hypertension. Of course, hypertension and preeclampsia constitute more than 50% of risk factors for placental abruption. Okay, so the best one response here is hypertension. Next question, please. Which of the following is a complication of the third stage of labor associated with forced placental separation? Again, which of the following is a complication of the third stage of labor associated with forced placental separation? A. Endometritis. B. Uterine atony. C. Asherman syndrome. D. Cervical tear. E. Uterine inversion. Please choose the one best response. The one best response here is E. Uterine inversion. Go to the next. What is the primary mechanism of placental site hemostasis? What is the primary mechanism of placental site hemostasis? A. Increase uterine blood flow. B. Prostaglandin secretion. C. Maternal hypotension. D. Decrease the cardiac output. E. Vasoconstriction by contracted myometrium. Please choose one best response. Of course, it's clear enough that the answer is E. Vasoconstriction by contracted myometrium. Contracted myometrium will close the sinuses. Okay? Next question, please. A 36-week gestation, where would you expect to feel the uterine fundus? Easy question. A. At the umbilicus. B. At symphysis pubis. C. Xiphisternal. D. Halfway between umbilicus and xiphisternal. E. Halfway between umbilicus and symphysis pubis. The one best response here is B. Symphysis pubis. Sorry, C. Xiphisternal. I'm sorry, xiphisternal. As you know, 36 weeks gestational age, the fundal level is expected to be at xiphisternum. So the one best response here is C. Xiphisternum. Okay, go to the next, please. Optimally, when should cerclage procedure be performed? Again, optimally, when should cerclage procedure be performed? A. Preconceptional. B. Between 6 to 8 weeks gestation. C. Between 12 to 16 weeks gestation. D. At first sign of cervical dilatation. E. Between 8 to 10 weeks gestation. Please choose the one best response. The one best response here is C, between 12 to 16 weeks gestation. Go to the next, please. Appropriate management of first trimester missed abortion includes which of the following? Again, appropriate management of first trimester missed abortion include which of the following? A. Vaginal misoprostol and dilatation and curettage. B. Hysterectomy. C. Chemotherapy. D. Radiotherapy. E. Oxytocin infusion. Please choose the one best response. The one best response here is A. Vaginal misoprostol and dilatation and curettage. This is the end of this quiz. I hope it is helpful for you. Okay, this picture belongs to my box, published on Amazon, textbook of obstetrics, textbook of gynecology, contraception handbook, multiple choice question book, where you can find many MCQ there, medical disorder in pregnancy book, and the gynecologic oncology book. The link of my site on Amazon here, and I put it in a comment. And the blue one is the link of YouTube channel where you can find more quizzes in OB/GYN and more lecture skills and others. Okay, so you can find it, and I'll write in a comment the link of YouTube channel and my site on Amazon. Thank you, everybody.